Hi, my name is Dr. Walp. This is Dr. Doe. We are two of the gastroenterologists here at Doylestown Health Gastroenterology, and we are here to talk to you about everyone's favorite test, the colonoscopy.
So a colonoscopy is a medical test where we examine your colon and your rectum for any medical abnormalities. Now, the American Cancer Society, as well as the United States Preventative Task Force, has updated their guidelines recently. They recommend starting screening colonoscopies at the age of 45. Yes, 45, that has changed. Now, if you have a personal family history of colon cancer and or active symptoms, this may need to be done at an earlier age.
So in order to have a good quality colonoscopy, it's really important that you follow the instructions that we give you ahead of time to clean out your colon. Your main job is to get all of the stool out of your colon before you come in. So before you get to the procedure area, a clear yellow liquid should be coming out of your rear. And that's when we know all the stool is out of your colon and that you're ready for a good test. So you may have heard about the prep. Now, not everybody's favorite part, but we will give you detailed information about the prep ahead of time, and we urge you to read it at least 2 weeks before, 1 week before, and a couple days before, so you don't miss any of the directions. You know, there's two types of preps. Either way, you're going to be drinking a lot of fluid. Do not eat anything solid the day before to help you clean out. And you can have all the clear liquids that you desire, like broth, water ice, jello. Whether we schedule you over the phone and discuss the prep with the scheduler, or if it makes you more comfortable, please make an appointment. Come in, meet us, meet the doctor, and discuss which prep would be best for you. So there's a variety of preps that will get the job done. Some are completely over the counter. You can mix things like Gatorade with Miralax. And there's even a newer prep that just came out this year that includes taking multiple pills with water. All right, so how about we tell you where to go on the day of the procedure so you know what to expect to make this a less anxious day. So this is the GI suite. This is where we do the majority of our procedures. So the GI suite is located in the pavilion, which is located behind the hospital. We're on the first floor. So if you come in through the south entrance, and then you just take a right where it's suite 102. So probably one of the problems that people just talk about is parking. So in order to make it easier for you, there is, number one, there's valet parking. So there's complimentary, it's free. So if you feel anxious about parking, just use it. Otherwise, you do need to be dropped off because someone will have to drive you home after the procedure because of the anesthesia. And when you come in, so you'll be here, you'll come and check in at the front desk, and you want to make sure to bring your medicine form, a list of all your medications with you when you come in, okay? And then we'll show you the actual endoscopy suite where you check in. Once you check in at the front desk, we're going to go to the back where all the bays are located. One of the nurses will bring you back. Once you're there, you will change into a gown. You can put all of your belongings into a bag. Please try not to bring anything too valuable because it is going to be by itself for a while. You won't always be with it. And then the nurses will do a quick kind of history and physical. They will put an IV into your arm, and that IV acts to give you fluids to help hydrate you because granted you've been through, you've probably been having a lot of diarrhea through the night, so it's good to get a little hydrated. But also that IV will serve to give you medications to make you nice and comfortable so you won't remember or feel the procedure. Okay, so this is the GI suite, and this is an example of one of the bays that you would be brought to, so where the nurses can check you in, and also the anesthesiologist will see you ahead of time to go over any anesthesia questions that you may have as well. So Dr. Doe, now that the patient's checked in, what happens next?
Oh yeah, so when we're ready, we're gonna roll into the room. So let's go in and see where the action is.
Okay.
Once you get rolled into the room, you will meet your gastroenterologist, have a quick conversation, and review the consent for the procedure. After you sign the consent, you will then roll onto your left side and the anesthesia staff will put you to sleep with IV medication. The sedation medications that we use generally here is propofol. However, upon a conversation between you and our anesthesiology team, we will determine what is the best medication for you. Generally, this medication, you fall asleep quickly and you wake up quickly. Many people, in fact, say it's one of the best sleeps they've ever had. So now, what is the equipment that we use? So right here, I have a sample of our adult colonoscope to show you. It is a long tube. It's flexible and has a fiber optic camera at the tip. What we do with this tube is we insert it very gently once you're asleep all the way to the end of the colon, and then we come back out looking for things like polyps. This tube is very complex and it has different channels in which we can put different interventions like snares or biopsy forceps or different equipment to do a variety of interventions within the colon. Now, one of the things that is of great interest for us is looking for polyps. What are polyps? They are benign small growths that arise in the colon, and often they have precancerous potential. If we remove them when they're small, they will not have an opportunity to grow large and become cancer or cause troublesome symptoms. This is one of the best ways that we can do a colonoscopy because we know that for every polyp that we remove, we can increase lifespan. Now, once you're done, the procedure generally takes approximately 30 to 45 minutes on average. You will kind of go back outside and you'll awaken in the bay in which you came from. You will generally feel a little groggy, but as you wake up and your vital signs and monitoring vital signs are stable, you'll be allowed to have juice and crackers. Your doctor or gastroenterologist will come out and speak with you with the results. We have a comprehensive report including all the fun pictures, because who doesn't want to see their insides, and we'll go over all the results with you. Now, there is really minimal to no pain during the colonoscopy. You're sedated and very comfortable. Some people, though, do feel when they awaken that there could be gas or some pressure, but that pretty much resolves very quickly. Now, the results are discussed immediately with you after the procedure is done, but if any biopsies or polyps are removed, generally we send them to the lab and we get the results back within a few days, and then call you with that result afterwards.
So Dr. Doe, what policies are in place to keep us safe during COVID?
Yeah, what a great question. So currently everyone who comes to the lab must wear a mask. We are now starting to allow one visitor per patient who must remain masked at all times. Now, there is no eating or drinking in the waiting area, and the chairs have been placed socially distanced apart. Anybody who undergoes an upper endoscopy, where the procedure goes through the mouth, is COVID tested, unless they have been vaccinated fully 2 weeks from their second vaccine. Furthermore, we do enhanced wipe down of all the equipment in the rooms in between patients.
Great. So you may be asking yourself, how do I sign up for this procedure? So there are two different ways to schedule your screening colonoscopy. If you're healthy, you have no chronic GI symptoms, meaning no chronic diarrhea, chronic constipation, rectal bleeding, you can often just fill out open access paperwork. This form can be found at your local primary care, or you can go to the Doylestown Health website, type in open access colonoscopy, and there will be a link at the very bottom of the page. Click on that link, print it out. You can fax it to us, mail it to us, drop it off. Either way, through open access, you'll get a call from one of our schedulers who will go over the criteria to make sure that you're a good candidate to not be seen ahead of time in the office and go through our open access program. But overall, we're here to help. Our goal is to prevent colon cancer. So please don't let anxiety about the colonoscopy, about the prep, or about COVID delay your care.